Welcome everyone, and today we are gonna look into diabetes and cancer. So as you probably know, diabetes is a giant problem in the United States and all across the Western world, increasingly also in China and in India. And diabetes is fundamentally a problem and disease of our metabolism, and it has something to do with insulin resistance, with the pancreas, and the inability to manage glucose effectively in the blood. The reasons for that are manifold, but here's the real problem. What we think about diabetes is it's a chronic condition, not as dangerous or terrible as cancer or strokes or heart disease or Alzheimer's or Parkinson's. So it's one of the four horsemen: neurodegenerative, cardiovascular cancer, and diabetes and metabolic conditions. But it seems to be the least threatening. At least that's what people think. And the problem here is that at face value, it looks much less dangerous. The primary cause of death being diabetes is only true for roughly 50,000 deaths per year in the United States. So 50,000 people die actually of diabetes every year. That compares with 700,000 or 600,000 for cardiovascular and cancer. So therefore people think, oh, it's not a big deal, it's just diabetes, we just manage it, some insulin injections, and that's fine. I think that's a very wrong and flawed perspective, because diabetes is actually far more dangerous than its primary cause of death statistics imply. And the reason is that diabetes is a major risk factor for all the other conditions that kill so many people. In other words, if you have diabetes, type 2 diabetes, your risk of getting cancer and dying of cancer is dramatically higher than if you don't. And therefore a lot of cancer deaths are actually directly connected to diabetes. And today we are going to dive into the statistics and see what is really going on. So the way I want to do this is look at a study. Here's a study in Nature, that's a very important journal in medicine and science. And this is a national observation study of cancer incidence and mortality risks in type 2 diabetes compared to the background population over time. And that is actually a study that has been done in Sweden with 457,473 patients with type 2 diabetes between 1998 and 2014. And what the authors wanted to figure out with very solid statistics that are used here, very solid control cohort, what is the risk elevation in cancer if you have type 2 diabetes? And here is some of the results, and you see that this is really bad. So type 2 diabetes had a higher risk for all cancers. The hazard ratio here for across all cancers is 1.10, so 10% higher risk of getting cancer than the comparison cohort. That sounds not as bad as it actually is, because if you look into the details here, liver cancer, 3.31 hazard ratio, that means 231% higher risk, more than 3 times higher without diabetes. And with the pancreas, you have 119%, so twice as much risk of getting pancreatic cancer, one of the most deadly cancers with type 2 diabetes. Uterine cancer, 78% elevated. But also colon cancer, one of the most prevalent and deadly cancers, 20% elevated risk. So that is all not good news. And we can also look into this figure 2 here, take a closer look here. And what you see here is the authors listed the most associated cancers. So here you see liver cancer, and you see 3.31 hazard ratio, followed by pancreatic cancer, 2.91, uterine cancer, 76% elevated, 1.76, gallbladder cancer, much higher, kidney cancer, 45% elevated, stomach cancer, 21%, bladder cancer, 20%, colorectal cancer, 20%. So that is very bad news. That is the risk of all these cancers you're getting if you are type 2 diabetic and don't do anything about it. Very concerning. And when you scroll down here, this is where they basically looked into the post-cancer mortality, which means after you have been diagnosed with a cancer, what is your chance of survival, or how many people die? This is diabetes compared to control cohort. Here specifically cancer-specific survival, which is like kind of an inverse of this. So you see the mortality is clearly elevated. So for example, for uterine cancer, 25% higher risk of dying of that cancer. Colorectal cancer, 10% higher. 12% higher for bladder cancer. And here you see, on the cancer-specific survival side, the appropriate correlation, right? So what is your chance of survival? You have a 6% lower chance of survival for liver cancer. You have, for example, a 6% lower chance of survival for stomach cancer, and so on and so forth. So not only is the risk of getting cancer, all these cancer types, very, very elevated when you have type 2 diabetes, your chance of surviving after you get diagnosed with the cancer is also lower. So we can now ask why that is. Like, what is the problem here between what's the correlation and what's the mechanism of action? Of course, no one has the real answer. We have some indicators what might be happening here. And here's a study on cancer.gov, not a study, an overview on the National Institute for Cancer that has to do with obesity and cancer. And when you read up how might obesity increase the risk of cancer, first of all, here is a list how obesity and being overweight influences cancer. And you see that there's some significant problem. So endometrial cancer is 7 times as likely in people with severe obesity, 2 to 4 times as likely in people with obesity or overweight. Same for esophageal cancer, for gastric cancer, for liver cancer, kidney cancer, and so on. So liver cancer, for example, 2 times as likely in people with obesity or overweight. So what's going on? Well, they have different explanations here. For example, fat tissue is implicated in producing excess amounts of estrogen, which is known to affect breast cancer, endometrial cancer, ovarian cancer, all the OBGYN cancers negatively. So more fat means more estrogen, means more cancer. But we also see here, people with obesity often have increased blood levels of insulin, and insulin-like growth factor IGF-1. And we know that high levels of insulin, hyperinsulinemia, is due to insulin resistance and precedes the development of type 2 diabetes. High levels of insulin IGF-1 may promote the development of colon, kidney, prostate, and endometrial cancers. That's very well known. Colon, kidney, prostate. Now, diabetes is fundamentally an insulin resistance problem, right? Even in the end, the pancreas might stop actually producing sufficient amounts of insulin. In the beginning, it all starts with your cells not reacting to the insulin in the blood and not being able to take up the glucose. And that is highly correlated with the development of all these cancers. So we see that there is this natural connection between obesity or being overweight and diabetes and cancer. It's this triangle where all these things correlate, and that might be one of the big reasons why diabetes is such a big problem in cancer. So the bottom line here is type 2 diabetes is a dangerous disease, and that at face value might look less dangerous than it is. This death toll of diabetes of 50,000 people a year becomes much more threatening or dangerous looking when you add in all the excess deaths it creates in cancer, cardiovascular, neurodegenerative, and so on. So that quickly ramps it up to the hundreds and hundreds of thousands of people who actually die indirectly of diabetes, or who would not have gotten cancer or cardiovascular disease if they would not have gotten diabetes or insulin resistance. What is the bottom line, and how do you save your life? Well, don't get diabetes, don't get type 2 diabetes. And the way to not get it is early detection through a test that is called A1C test. Very cheap test. Unfortunately, your primary care doctors do not prescribe that in sufficient numbers, in my opinion. And my take on this is A1C once a year costs $20, highly recommended, because A1C gives you the average blood glucose levels over the last 3 months. And that tells you a very well established metrics. A1C from 5.7 to 6.4 makes you pre-diabetic. And if you're pre-diabetic, you're on your route to type 2 diabetes, and you don't want to get there. And if you're pre-diabetic, you can take action. You can change your nutrition, you can do fasting, you can do exercise. There are very well established protocols how you reverse pre-diabetes and how to be much more successful than if you wait until you have type 2 diabetes. I wanted to do this video so you understand the severity of diabetes, and to not take A1C and pre-diabetic status lightly. You need to reverse it. Do not let it get into type 2 diabetes. If you currently have type 2 diabetes, there are always ways out of that. There are treatments, of course, and there are reversal strategies. It's harder if you have type 2 than compared to pre-diabetes, but it's possible. So don't get discouraged, and it doesn't mean you are guaranteed to get cancer, you just have this elevated risk. So the ideal path here is always lose body weight, really take this seriously. Try to reverse it through nutrition, exercise, and lifestyle changes. I hope that was helpful. Subscribe to this channel, then you will see more updates on, for example, the A1C test and how to get it and what to do about it. You will see more updates on diabetes, on cancer, on Alzheimer, Parkinson, cardiovascular, and of course on new screening modalities that keep you much better protected than the current standard of care allows you to be. Thanks for watching, and hope to see you soon. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a board-certified physician or other qualified healthcare provider with any questions you may have regarding a medical condition. You should not disregard or delay in obtaining medical advice for any medical condition you have or think you have, and you should seek the assistance of a healthcare professional for any such condition. The views and opinions expressed in this podcast are my personal views and opinions and do not necessarily reflect the official policy or position of any company I'm involved in.